As Mental Health Awareness Month comes to a close, we're shining a spotlight on a local business making a big impact through virtual care. Diverse Health is on a mission to provide culturally competent primary care and mental health services to underserved communities across the country.
Joining us today to talk about the importance of cultural responsive mental health care is founder and CEO of Diverse Health, Timika Goodson. Ms. Goodson, thanks so much for joining us.
Thank you so much for having me.
Yeah, so can you talk a little bit about what inspired you to start a diverse healthcare business?
Sure. So I started Diverse Health in 2021 as a dual certified nurse practitioner providing both mental health and primary care. For too long, underserved communities have been left out of the conversation surrounding mental health, and Diverse Health seeks to change that by providing care that is accessible, culturally sensitive, and empowering.
And I feel like a lot of times in the Black community, we don't really talk about mental health and things like that. So why do you think cultural competence is so important when it comes to mental health?
That's a great question. So cultural competence isn't just a buzzword, it is a necessity. And so people are suffering in silence, and when you have a provider who understands you and respects your unique backgrounds, that's when real healing can begin.
And can you talk a little bit about some of those misconceptions when you talk about culture competent care in your field?
Sure. So from misdiagnosis to dismissal of pain and racial bias, these are real things that affect our communities. And so we're changing that at Diverse Health. We're meeting people where they are while also celebrating their lived experience.
And how do systemic inequalities kind of intersect with mental health delivery?
Yeah, I mean, I think I already talked a little bit about some of the things we hear about most frequently, like having our pain levels dismissed or being racially biased when receiving care. Those are the things that impact us directly and impact our families, and it really is time for us to do something about it. And so Diverse Health has developed a nationwide platform that really meets people where they are and seeks to bridge those gaps.
And can you also talk about the importance of having that virtual care from a physician?
Yes, so we use virtual care as a bridge and not a barrier. And so whether patients live in a rural area or are juggling two jobs, or if they just get anxiety when walking into a medical clinic, we're still able to provide quality care to patients, those patients who really need it most.
And how have you seen that virtual care kind of change the experience for individuals who can't maybe go in person or anything like that?
Yeah, so because virtual care allows people to stay in their homes, they're really able to show up as themselves, stay in their comfort zone, and feel comfortable while receiving their care. We've treated thousands of patients since 2021, and we've received feedback that this is the first time they're feeling heard, they feel respected and valued by their providers, and those engagements are what improve patient outcomes.
And when you're hearing those comments from patients, how does that make you feel knowing that you created this business and you're hearing positive feedback?
Yeah, it really makes me feel like I am walking in my purpose and in my passion. You know, I knew that this had to be bigger than myself. I started the business serving an immediate need in my own community, and quickly found that people from all over were really looking for this level of personalized care.
And even though you have been getting good feedback, I'm sure that there's still some challenges. So what challenges do remain within the underserved communities?
Well, there's a lot of stigma around mental health, but beyond that, accessibility is a major concern. And so right now, we're looking to bring our services to all 50 states nationwide. And as a part of that, we're currently raising $1 million in a seed funding round to really catapult our growth and reach those communities in need.
All right. Thank you so much for coming in and joining us today.
Thank you so much for having me.
Well, Diverse Health currently operates in more than 30 states and is on track to serve 200,000 patients by the end of 2025.
For more information or to schedule an appointment, visit mydiversehealth.com.